Opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez, and please help me give a warm welcome to Dr. Gogineni, who is right here in Boca. He is at 660 Glades Road, Suite 140 in Boca Raton, Florida, 33431. And it is mdvp.com, where you can look up his website. And the phone number is 561-800-4570. Thank you for coming on the show, Dr. Gogineni.
Thank you for having me, Louise.
We appreciate you coming, and we always like to learn about different types of practices and a little bit about what different doctors do. And I know you are board certified internist, right?
Yes, exactly.
Can you tell us a little bit about maybe your studies and a little bit about your background, and we'll delve into what you do now after.
Absolutely. So I grew up outside of Chicago, actually, and then for med school I went back to India to kind of explore and to kind of get used to that culture there, which was a wonderful opportunity.
Nice.
And after med school, I came back and I started my training in Michigan, Ann Arbor, Michigan. And we ended up staying in Michigan for about 15 years. We loved the town. I think after a while, we decided that the cold wasn't for us anymore.
Okay.
And, you know, this time of year, it's perfect to be down here right now.
Oh, yes, absolutely.
And so about 7 years ago, we decided to move down to this location down here in South Florida, and we've been loving it.
Nice.
Absolutely. And then for the initial 6 years, I worked at the Cleveland Clinic down in Weston.
Yes, they have a great reputation.
Yes.
I hear wonderful things about Cleveland Clinic.
It's a wonderful hospital. I love the staff there, the other physicians. It was really well run. But about a year ago, I decided that I wanted to kind of go out on my own, start my own practice. And so when I looked around, looking at different models of how these practices run, I decided this MDVIP model was really, had a lot of benefits for myself as well as for the patients, really.
I feel like it's trending in that direction because this is a membership model, is that right?
Yes, exactly.
Yeah, and I have interviewed several other doctors who have also done that type of membership model, and I feel there is more of a demand for it. More and more people are wanting that. So can you share with the audience a little bit of some of the benefits that somebody would have going to this type of practice?
Absolutely. So, you know, most practices, most primary care, internal medicine, or family practice practices in the old model, you have to keep anywhere from 2,500 to 5,000 plus patients in order to survive.
Wow. Yeah, that's
a lot.
That's a lot.
Yeah.
That gives you like what, 5 minutes per patient?
It was, you know, if you're in a private practice, sometimes you're seeing 25, 30 patients a day.
Yeah.
You have to have other staff like nurse practitioners, PAs, who have to see some patients. And you just need a large staff even to maintain, you know, to be on top of your patient's care.
Right.
Even to submit to insurances, you had to have multiple billers to do that work. In this membership model, what it affords us is this ability to, yes, we charge a small fee so that we can maintain a much smaller practice.
Nice.
So now, we maintain a practice of anywhere from like 400 to 600 patients.
Much better.
Yeah, much better. And that really gives the patients a lot more time with their physician. They know that the physician knows them. They're not just another number.
Yeah.
And, when the patient wants to be seen, they want to come in, they can just call the office, and usually it's the same day or the next day they just come in and see us.
Nice. So as a new patient, what would I be able to expect from my first initial visit? What type of treatment or how would that workup look like?
Yeah, so with all my patients, I actually, before they even join, I invite them to come in for a meet and greet.
Oh,
so
nice.
they can actually come and take a look at the office, meet with me, spend 15 minutes, half hour with me just to see, talk to me about their concerns, what they're looking for in their medical care. Make sure they're happy, we can have a nice conversation. After they do decide to join, we actually have them come in for like a initial visit, and I spend like an hour
Nice.
with the patient, really going in depth at their history, other physicians they've seen, their medications, things in their life that may be affecting their health. I think that there's a lot of stuff that when you're limited to a 15-20 minute visit, you just can't get into.
Right, right. And what about, do you do any type of different testing that maybe the traditional doctor wouldn't do that type of testing?
Yeah.
What
Yeah,
can you share with us about that?
So with MDVIP, we actually do a executive physical once a year. And so in that physical, the patient comes into the office for about an hour. We do lab tests right in the office. So we draw the blood for them. We do an EKG. We do gait testing. We do
Say that again?
Gait
What is
testing.
that?
Just to see, how fast their gait is, if they have slowed down. We do have a lot of patients who are even in their 80s and 90s, and trying to identify early on if they're having problems with their gait, maybe looking into getting them physical therapy,
I see.
making sure they're safe to cross the street even. We do audio testing, we do vision testing right in the office, and then after that initial lab testing, I meet with them for another hour to an hour and a half and really go in depth about the results and what their plan is for the year.
I like that.
Yeah.
So you also do the blood work on site?
Yes, we do it right in the office. I've even invited patients, if they have blood work from their specialist that they need to get done, instead of going to Quest or LabCorp, just come in the
Nice.
office and we'll draw the blood for them.
That makes it so much more convenient to be
Yeah.
able to feel like you're having a one-stop shop.
Yes,
Instead
absolutely.
of having to, go to different locations. I feel that people want that type of attention.
Yeah, and there's
Yeah.
no waiting. I mean, usually because we're a smaller office, they're not waiting a half hour, 1 hour for the blood draw. Like even if they have an appointment or scheduled appointment at Quest, patients have told me that they've had to still wait
Sure.
for their turn, and
Yeah.
usually it's a 5 or 10 minute wait for them in our office
Nice.
at the most.
Nice. So I was going to also ask you, what do you share an office with somebody else in case, like, I need to call you and maybe something happens and
Yeah,
you're not
absolutely.
Yeah.
So, I am the go-to person when you call. So,
Sure.
If you call after hours or the weekends, it will go to me. I'll answer my cell phone.
Nice.
And we can discuss it. When I'm out of town or I'm traveling, I do share an office space with Dr. Shannon, Keitha
Okay,
Shannon,
nice.
and she's been doing this for 3 years, so she's been really great to work with. And so we cover each other.
That's
so
good.
if she's traveling, I cover for
like
her,
that.
and she does the same for me.
That's good to know. So what if I am an MDVIP patient of yours and I'm maybe traveling somewhere else, out of state to New York or something?
Yeah.
What would that look like?
Yeah, absolutely.
I needed
So-
to reach you.
Yeah, so I mean, I have patients who are traveling either for work or they live half the year up north. So they just call right up to the office. If it's something that I can handle, we may do a telehealth visit. So it's like a video
Okay,
visit
sure.
right from where they are. And when I listen to them, and if it's something that I feel needs a little bit more hands-on, I can direct them to another MDVIP affiliate office
Nice.
in their location.
That's good.
And there's probably close to 2,000 or more affiliates all throughout the
Wow,
country.
I like that.
So really, we're everywhere. I've had patients who have been in kind of the Upper Peninsula of Michigan who have contacted me, and we've been able to find them a physician pretty close by.
That's good.
And they're usually be able to be seen within that same day or next day.
So I know you do more in-depth blood work than maybe the regular type of physician. Can you share with us a little bit more about that blood work and what it would entail, and what would we find out about that?
Absolutely. So, like a typical annual visit, we do all your basics. So your blood count and your electrolytes, your metabolic panel, your kidney function, your liver tests. We do the lipid profile, which is what you normally see with your cholesterol level. But we found that even when you have a normal lipid profile, people were still having that risk of heart disease and stroke. And so MDVIP probably started this sooner than even it's gone national to kind of the general practitioners, is they've started testing for myeloperoxidase.
What is that?
A myeloperoxidase is an inflammatory enzyme that's found in the vessels around the heart. And so if that's elevated, they may indicate that there possibly is some heart disease going on, that we need to get the patient in to see a heart doctor sooner. We also look at other preventative labs like the NMR lipid profile.
Okay.
So beyond your normal LDL levels that you get with your cholesterol levels, the NMR profile tells us kind of what sizes those LDL particles are.
Oh, okay.
So we know that the smaller LDL particles can be more dangerous. And so if we see an elevation of those LDL particles, there have been studies that have shown that your LDL, even if it's normal, but the small particles are elevated, you may be at higher risk of heart disease and stroke. And so we maybe have a different goal for you rather than just treating the LDL and keeping it down.
I like how you how you investigate different avenues, because heart disease is it the number one?
Yes, it is.
Okay.
And heart disease is still, even though we've had so many advances in heart disease and heart treatment, it is still the number one killer in the U.S.
So what I like is that you're not doing your traditional, okay, here's the test, here's your number, and these are your these are your biomarkers. You're in the normal range, but you're going a couple of steps further, and you're investigating other ways and other markers that people want to know.
Absolutely.
People want to know what, especially if it's maybe, my father had it or my grandfather, or we think it's genetic. And is this genetic also?
Some of it is.
Okay.
I have patients who eat very healthy. They exercise 7 days a week, and we come back and we look at the numbers on their
Right.
profile, and they're elevated. And whether it's their LDL or their other biomarkers, or even their diabetes risk is elevated. And I tell them, it's nothing wrong that you're doing, although we do look at those things very
Sure.
carefully. We look at their, what types of food and what portions of food they're eating. But if we see those elevations, we discuss, and I present to the patients, these are the options for you. Maybe we recheck it in 3 months after they've made some changes, and then we decide, is it the right thing to do to go on to medications or just the medication doses.
Got it. I like how you look at their whole lifestyle, and you evaluate, and you give them suggestions for diet, exercise, lifestyle. What about sleep hygiene?
Absolutely. I think sleep is vital.
Right?
I mean, I think, we definitely talk about sleep hygiene in my clinic, especially nowadays with our phones and our tablets.
Oh, yes.
And
So
our
true.
TVs. I mean, I really talk to them about, putting those away at least a half hour, 1 hour before bedtime.
Yes.
We know that blue light kind of convinces our body it's the daytime.
Isn't it
And
amazing?
so it's so hard to sleep after you've been looking at your phone. And it's very addictive also to look at the phone.
Sure.
You just don't want to stop
Yeah.
scrolling and looking at the latest news or the latest Instagram posts. But it is important to put that away. So I tell people, a book is still probably okay, or an audio book, or listening to some gentle music, something that will help you gently fall to sleep without turning on the TV or the iPad.
They say it takes 21 days to start a new habit. We have a quick commercial break. We'll be
yes.
right back.
All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back in. We are having a delightful conversation with Dr. Gogineni, and he is at mdvip.com. The phone number is 561-800-4570. The address is 660 Glades Road, Suite 140, right here in Boca, 33431. I'm enjoying this conversation, Dr. Gogineni.
Same here. You've been wonderful. Thank you.
Absolutely. So we spoke a little bit about sleep hygiene. I know there are so many components that and different factors that we as a patient have control over.
Yes.
Right?
Yeah.
What are maybe some other things that we can...
Yeah, I mean, I think exercise, of course,
Yes.
is valuable, and we're seeing the value of it more and more with all the newer studies that are coming out. You know, some of the latest studies have shown at least 150 minutes a week is very valuable.
Mm-hmm.
We're seeing, you know, prevention of osteoporosis, decrease in risk of diabetes, decreased risk in heart disease and stroke. Even things like dementia we've seen the benefits of exercise delaying or preventing onset of dementia.
That's a big one, dementia and Alzheimer's. I know it's something people are concerned about. What are some of the things that we can do to prevent dementia? Are there any type of pre-tests or things that we can look into to see?
Absolutely. So I think one of the biggest things, of course, like I said, is taking good care of yourself. So healthy diet, exercise routine, I think is very important. When we do meet with patients, it's vital that we get a good family history.
Okay.
So if there is a higher risk, so let's say a parent had Alzheimer's or dementia, I think being on top of that and closely monitoring patients, you know, some of my patients are in their 50s and 60s, very young, and so what we're doing every year, along with the rest of the testing, is we're doing like a mini mental status exam.
Okay.
Where it's that 20
Nice.
question test to evaluate their mental status. And we look at the scores every year and see if there is a decline or if there is a change. If we do start to notice things like that, we get them early into the neurologist to get a further evaluation.
What are some of the things that cause dementia? I've heard so many different theories. I don't know, heavy metals, or is it, I don't know. Who knows?
I mean, I think the studies are still out, exact causes. We know that there is some aspect of a genetic risk, a family history risk. I think there are some medications that can predispose to delirium or dementia.
Oh, interesting.
You know, we were talking about sleep hygiene, so some of
Yes.
this, you know, unfortunately, there's a lot of people who suffer from insomnia.
Right.
and
What would you do with a patient who has insomnia? What would you recommend?
We try to look at safer agents. Some of the supplements can help. You know, things like sleepy time tea or melatonin. We can start with that. Good sleep hygiene, like we talked about. You know, going to bed when you're tired or sleepy rather than waiting. You know, or trying to read or watch TV in bed.
Yeah.
Is helpful. But we do have other medication choices, and I think choosing the right medication that has that decreased risk of delirium later on. You know, we're seeing things like the benzodiazepines or the Ambien. Long-term use, especially as we get older into our 80s, can have that increased risk of dementia.
I see. Interesting. I like how you try to always find a different, maybe natural way. What can we do, like firsthand? You know,
Yeah, absolutely.
natural.
I think lifestyle makes a huge difference, and you know, stress. I mean,
This is true.
getting stress under control is a big deal. So, you know, because we have the time, I talk to patients about the stressors in their life. What's how's work, how's family life, what's happening, what is maybe a big stressor? Is it temporary? You know, is this trouble with sleep because they're going through a big family event that's coming up?
Sure, sure.
And so I think that makes a big difference.
Are there any things that we can do to reduce stress?
Exercise is
Okay.
very, very helpful. Yoga,
Yes.
meditation.
We all, you know, we need as many tools as we can nowadays. We're bombarded with information, you know, social media, phones, just constant, as opposed to 20 years ago. It
Yeah.
wasn't as much. So
Exactly.
it's just overstimulation.
There's a lot of that. And I mean, I think therapy is helpful.
Absolutely.
You know, being able to talk to someone about what's stressing you out. So part of that is my job, you know, when they come to me. But at the same time, I do refer patients to therapists.
Good.
And sometimes it is medications that we have to go
Right.
to, and which is okay.
Sure.
And like I said, if it's temporary, we can take them off of it. If it's we try a low dose of medication first, and just see if the lowest dose possible that can help
I
them.
like that. I like that. I know you have a couple of good devices. If I were to go to your office, what is the device that you have that? Please
Yeah,
remind me the name of that.
Of course, it's the InBody test.
InBody,
Yeah.
uh-huh.
So the InBody is great because not only does it, you know, when you go into your doctor's office, you always get like a weight check.
Sure.
But it's also important how that weight is distributed. You know, is it muscle weight that that we're measuring, or is it fat weight, or you know, water weight? And that InBody test gives us a nice sheet that we can look at, and we sit down during that annual exam, and we kind of really go in depth, and we look at the composition. And a lot of times, you know, we used to use BMI as a measure.
Right.
And I felt like we all feel like that's too inaccurate. Because you could have a very muscular person who has a high BMI.
Right.
And it looks bad on paper,
I see.
but it's just muscle weight that they're measuring. And so what I often do is we do it during the annual, and if they're making some lifestyle changes, they're making some dietary changes, I tell them come back in 2-3 months, or
Nice.
we'll do it again, and we can see how the change in composition. And it's very encouraging for patients.
I was going to say that. I like that because if I'm working hard, I want to be able to see like the tangible evidence, like, oh,
Absolutely.
my muscle mass went up and my fat went down, and you can see the tangible evidence on paper, right?
Yeah, exactly. And sometimes the weight may not change, but
Right.
they feel better in their clothes.
That's right.
They feel like in the mirror they look better. The weight hasn't changed, and they're frustrated by that. But then they come in and they do this InBody, and it
Exactly.
shows the change.
I like that.
And then with that measure of kind of the different body composition, we can give them a pretty accurate measure of how much calories their body is burning in that 24 hours
Oh, okay.
without exercise.
Nice.
So we know kind of what their baseline calorie count should be. So if their goal is to lose weight, you know, we talk about, okay, how many calories below that should they be, and how does exercise affect that?
Nice. I didn't ask you if you accept insurance.
Yeah, we do. So I do take Medicare patients, of course, and then we accept most private insurances also.
Okay.
And
nice.
so we have no problem. And, they just call to the office and we can discuss the insurances. I've taken some patients who are out of network and then they pay like a small fee
Okay.
just for their office visits.
I like that. So you want to work with everybody. It
Absolutely.
sounds like you really want to be able to help people.
Yeah,
Yeah.
I think Boca is a great area, but there's a dire need of primary care physicians. Most places, even when they call or when you call to get a primary care, the wait time to get in, even that initial visit, is sometimes a month or 2 months out.
I've heard this before.
Yeah, and so for me, if they come in, we can probably get them in within the week.
I like that. Wow. Dr. Gogineni, we actually have 1 minute left. This interview has gone by really fast. Any call to action? Anything you want to share with our audience?
Yeah.
Any great stories? Please feel free.
No, I think having a good primary care is very valuable. Whether it's me or another primary care, it is really they are the hub of your healthcare. It's not, the specialists are important and they do a great job, but having one person who knows your overall health is wonderful.
I agree. Yeah. Well, what better place than to go to MDVIP? I'm going to give your a phone number again. It's 561-800-4570. And then your website is www.mdvip.com, which I heard stands for Value and Prevention. I did my homework.
Wonderful. Thank you.
Okay. Thank you. It was
Thank you for
wonderful.
having me.
Great interview. We'll see you next week, everybody. Take care. Look forward to it.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or